Okay, good afternoon, everyone. Thank you very much for coming along to the annual review for NHS Forth Valley. This is the first in-person annual review for NHS Forth Valley since 2019. Obviously because they were interrupted due to the pandemic. So it's an opportunity for us to hear firsthand from the board and for you as local members of the public in the Forth Valley area to ask questions, raise issues, and to hopefully provide you with a response. Where a response can't be provided, for the board to follow that up at a later stage. Annual reviews are a really important part of how we hold our health boards to account. They are responsible for spending a very large amount of taxpayers' money each year for investing in local health services and how these services are delivered locally. And it's appropriate and right that they are open to public scrutiny around how they go about managing that. That's why, from my point of view, coming along to conduct the annual review is really valuable, because already this morning I've had an opportunity to meet with a range of different groups in relation to NHS Forth Valley. So, for example, the first meeting I met with was the area area clinical forum, the AFC, which brings together clinicians from across the health service who are involved in engaging with the board around different aspects of how services are being delivered, to hear firsthand from them. Then I had an opportunity to meet with the employer-employee partnership, which brings together our trade unions, the executive team within NHS Forth Valley, to hear about some of the issues that they have, that they're working on together, and also some of the challenges and issues that they are progressing. And then I had an opportunity to meet with a number of service users and patients to hear from them firsthand about their experience of some of the services that are delivered within Forth Valley, and also areas where they think services are not sufficient, or where they think there could be changes made in order to improve those services. So before I hand over to Janine to say a bit from the board's point of view, this is a really important part of accountability for our boards, and I hope in the course of the question and answer session you'll have an opportunity to raise issues of concern that you may have, either national policy or local policy decision making around health, and we'll try to respond to them as fully and in as much detail as we can. The only thing I would say is that this is not an appropriate forum for dealing with individual clinical issues. Okay, so anyone who's wishing to raise issues which are quite personal in terms of involve personal care, this would not be the appropriate forum. We can deal with that out with this meeting and provide you with an opportunity to raise any issues with NHS Forth Valley officials, and that can be followed up after the meeting in itself. So I'll hand over to you.
Thank you, Secretary, and good afternoon. Jackie, could you kindly put the presentation on the screen, please, for those that might wish to refer to it? So it's a short presentation to outline some of our key highlights of our work, as well as some of our achievements and challenges. Move on to the next slide, please, Jackie. So a general overview of what I'll cover in the presentation is our COVID-19 response, our service developments, achievements, key challenges, and future priorities. Next slide, please. So as you highlighted, Cabinet Secretary, as this is the first annual review since 2019, I thought to take a few minutes to reflect on our local response to COVID-19 and highlight some of the areas we focused on during this particular period. So in terms of new ways of working, like many of us, we had to quickly adapt to the use of new technology and to communicate with our patients and each other, of course, as well as implementing guidance and following the latest advice on infection control, testing and treatment to help keep local staff and patients safe. And of course, that's when MS Teams that we all know now today, as well as NHS Uni supported us in that endeavour. In terms of supporting local care homes, this was a key priority for the board at the start of the pandemic. And we looked at how we could best support staff and residents in local care homes. We quickly set up a care home assessment and response team to provide specialist support and advice to local care home staff. This team continues to meet today and meets on a weekly basis and has helped to forge excellent links with local care homes across Forth Valley, which continues to support a range of work around health improvement, prevention and protection. With regard to our vaccination programme, we worked very closely with local schools, with care homes and partners to roll out our COVID-19 vaccination programme, which was very successful. I'd like to take this opportunity to thank our staff involved in delivering the vaccination programme, many of whom were redeployed from other service areas. And again, I'd also like to thank the University of Stirling and Forth Valley College for the use of their facilities as the vaccination centres in the early days before we developed our own dedicated vaccination hubs. In terms of our service recovery, as we moved out of the pandemic, our focus was very much on how we could get services back to normal, tackle the backlog which had built up, and return to pre-pandemic levels of activity. I'm pleased to say that this has happened for the vast majority of our services, and we continue to focus on reducing waiting times for care and treatment. Next slide, please, Jackie. In terms of our service developments, a couple of areas there I wish to cover. So during 2022-23, NHS Forth Valley took forward a range of service developments, and I'd like to take this opportunity to highlight a few of these. In March 23, the urology department at Forth Valley Royal Hospital became the first in Scotland to set up a new service for treating patients with a suspected recurrence of bladder cancer. The transurethral laser ablation enables abnormal tissue in the bladder to be removed under a local anaesthetic and in a clinical setting, removing in many cases the need for a general anaesthetic. In terms of our specialist cardiac MRI scans, these are now being carried out locally at Forth Valley Royal Hospital, which means that patients with heart failure no longer have to travel to hospitals in Edinburgh and Glasgow for these scans. Staff in our radiography department work closely with colleagues from the West of Scotland Regional Heart and Lung Centre at the Golden Jubilee University National Hospital to develop this new and important local service. In July 2023, we officially opened our urology hub at Forth Valley Royal Hospital to help improve the diagnosis of bladder and prostate cancers, to carry out a range of surgical procedures, and to provide a one-stop diagnostic and treatment service for local patients. A new service for patients with osteoporosis was launched in May 2022. It provides DEXA scans locally, face-to-face and telephone appointments, medication reviews and treatments. Slide 5, please. In terms of our achievements, in our advanced practice roles, we have significantly invested in developing a number of advanced practice roles across a number of services and supporting staff to gain the skills and experience required to take on additional responsibilities. Examples include advanced nurse practitioners who run a range of breast clinics for patients referred with suspected breast cancer and who also perform surgical procedures in both breast and plastic surgery, as well as other procedures following breast reconstruction. Advanced radiography practitioners are able to read mammograms, perform diagnostic ultrasounds, and take biopsy samples. Our nurse endoscopists have been trained to carry out a number of new endoscopy techniques, such as cytosponge endoscopy and colon capsule endoscopies. Surgical care practitioners carry out a wide range of minor operations, including vasectomies and circumcisions. Urology nurses carry out many diagnostic procedures, including cystoscopies. I found it difficult getting my tongue around that word, which uses a thin tube with a camera to examine the bladder and urethra. Prostate biopsies, bladder Botox injections, uroflowmetry tests, and prostate cancer diagnosis and care. In terms of our clinical research trials, local patients are benefiting from across a wide range of clinical trials following a significant increase in the number of research projects taking place across NHS Forth Valley. Our clinical research team is currently supporting more than 100 research trials in areas such as cancer treatment, cardiology, dementia, neurodegenerative diseases, diabetes, women's health, gastroenterology, mental health, paediatrics, and surgery. Examples include NHS Forth Valley is the only site in Scotland to join a UK study to evaluate the use of a urine test which could help detect womb cancer in under 3 hours. We are also the first NHS organisation in the UK to recruit participants to a clinical trial aimed at helping adults with early onset and mild dementia. This approach uses special headsets to record the brain activity of participants while they carried out a variety of tests to their memory, language, fluency, attention, and overall concentration. In terms of our recruitment, we continue to successfully attract a wide range of clinical and support staff. Examples include 110 posts of newly qualified nurses, 26 consultant posts were recruited since the summer of 2023. International recruitment over the last few years, we have recruited 44 nurses, 2 physiotherapists, and we plan to recruit an additional 18 nurses in 2023-24. The first of our 2 midwives recruited via the NHS Scotland International Recruitment Programme today started work at NHS Forth Valley, one of whom is from Finland and another from America. It's important to highlight that we also provide a comprehensive package of ongoing wraparound support to all staff recruited from overseas to help them settle in, adjust to life in Scotland, and to deal with practical issues such as finding suitable accommodation. More than 500 people attended our large recruitment event at Forth Valley Royal Hospital, which was a great result, and our recruitment team are planning to hold similar events in the future. In terms of our surgical and outpatient performance, the vast majority of people who require surgery, tests or treatment which are not emergency cases are classed as routine. We continue to be one of the best performing NHS boards in the country for delivering planned operations, outpatient clinics and day-based treatment. Next slide, please. In terms of Addison Psych accreditation, we have 2 wards, wards 2 and 3 in the mental health unit at Forth Valley Royal Hospital have received accreditation by the Royal College of Psychiatrists. Currently, 3 other mental health facilities in Scotland have managed to gain accreditation status and to achieve this prestigious recognition. NHS Forth Valley staff have had to meet around 300 standards to demonstrate their commitment to the delivery of high quality care and treatment. The rigorous and demanding process to evidence these standards being achieved and maintained took over 2 years to complete. Our Forth Valley University College and NHS partnership is a landmark partnership between the University of Stirling, Forth Valley College and of course NHS Forth Valley, and was launched in October 2022. This new partnership, which builds upon a long-standing relationship between the 3 organisations, will focus on 4 priority areas: learning, careers, research and innovation. And coming on to innovation, a wide range of innovative work is being taken forward across the organisation to develop new tests and treatments. Examples of this include eye screening, with a new technology that uses live video and audio feeds to connect doctors, opticians and patients in different locations and to ensure potentially serious eye problems can be seen by a specialist straight away and immediately diagnosed and treated. A pioneering low-cost device which takes 3D images of the retina has also been developed, which could transform eye screening and treatment across the globe. One of NHS Forth Valley consultants, Ian Livingston, was involved in the development of this device and is an example of an inexpensive add-on to a standard slit lamp that can extend 3D eye imaging to all settings where optometrists are present. Another example is skin cancer. Dr. Colin Morton, lead consultant dermatologist at NHS Forth Valley, is involved in groundbreaking work to help diagnose skin cancer within 25 minutes by 2025. The project, which involves using AI to assess images of potential skin cancers, has the ability to transform skin cancer care with faster, more reliable diagnosis. I'd like to also add, which is not on the slide, Cabinet Secretary, is that we had our staff awards last week, And the awards demonstrated the excellent work of our staff who continue to go above and beyond across the entirety of the organisation. And with over 900 submissions, it was a challenge to draw down and to identify our finalists and indeed our winners. Next slide, please. In terms of our key challenges, escalation, NHS Forth Valley was escalated to stage 4 of the NHS Scotland Performance Escalation Framework for Culture, Leadership and Governance on the 22nd of November 2022. A wide range of work has been taken forward in response to escalation, and we will take an updated assurance and improvement plan to our November board meeting, setting out our priorities and further plan changes and improvements that will be implemented over the next few months. With regard to our service performance, we have also experienced challenges in improving performance in a number of service areas, including the 4-hour emergency access standard, child and adolescent mental health services, and certain psychological therapies. A wide range of actions are being taken to address these, and progress is being closely monitored. Rising demand and complexity of all parts of Scotland, we are seeing increased demand for care and treatment across a wide range of health and social care services. With an ageing population, this trend is likely to continue, along with a rise in the number of people requiring care for dementia, as well as those living in several different chronic health conditions. With regard to available capacity, like many other hospitals across the country, we are also experiencing capacity challenges, and intensive work is currently underway to free up capacity across the local health and care services ahead of the challenging winter period. This includes efforts to carry out more assessments for services such as physiotherapy at home or in other care settings, to help prevent patients being delayed in local hospitals, and increasing the capacity of our hospital at home team, which provides medical care to people in their own homes so they don't need to come into the hospital for treatment. Slide, please. And finally, our key priorities, our patient and staff experience. We want to improve the experience of local patients who use our services, and while the vast majority of feedback we receive is positive, we recognise and acknowledge that there are areas where we can make improvements. We also want to ensure our staff feel valued, have access to the training and support they require. We will continue to listen to feedback from staff and patients and respond to the issues raised as part of an ongoing programme of culture change and improvement. On service performance, while our performance in many areas is very good, we recognise that there are other areas where it needs to improve to reduce waiting times and to respond to increasing demand. We continue to explore ways to increase capacity, to do things differently, and work with partners to help tackle some of the causes of poor health and reduce health inequalities. Financial sustainability, like all parts of the public sector, including health boards and local councils, are facing significant financial challenges, and these are likely to intensify over the next few years. We continue to do everything we can to reduce costs, particularly those in relation to bank and agency spend and prescribing, as well as identifying other ways of delivering services more effectively and efficiently, and making sure we make best use of the resources available. For workforce planning, we are looking to ensure we have the right staff with the right skills. Working in the right areas to meet the current and future needs of our local population is a key priority. We continue to work hard to recruit and retain a wide range of clinical and support staff, and invest in training and development to increase their skills and experience. And that concludes my presentation.
Thank you very much. Thank you very much. It's covered a whole range of work that's been taken forward by the board, showing very clear, good clinical innovation and development, and also some of the areas where they are looking to address to improve the way in which services are delivered. Given the performance in a number of areas is not where we want it to be, and the board recognise that and are seeking to take action to do that. I'm also I think I recall correctly at the Scottish Health Awards about a fortnight ago. I think it was a team in Ward 3 in the mental health unit actually got one of this Ward 4 got an award as well. Again, competing amongst the health services across the country. Again, I think it's a recognition of some of the outstanding work that's going on by some of your staff as well. And I want to take an opportunity to congratulate them on that and to encourage them to continue to innovate and to put services as we go forward. Before I open up to questions, the other thing I want to say is that there was a very high risk yesterday. This event was not going to take place. Because unfortunately, the building was flooded last night or yesterday at one point, and staff have put in a huge amount of effort over the course of the last 24 hours, pumping water out of the building, which they've stopped to allow us to allow the annual review to take place. I just want to put on my record my thanks to the staff for I know a huge amount of work it's going in over the course of the last 24 hours to try and help to allow the annual review to take place. So thank you for that. I'm now going to open up for questions, and I'm going to get started because we've obviously some written questions submitted. I'll hand it over to the board to respond to the questions and to bring in some of their executive team as and when they see necessary. But I'll offer up this question and then I'll open up to the floor. So those who are looking to ask questions, if you put up your hand, just say who you are and if you represent an organisation, and then we'll seek to respond to your question. The first question is about waiting times and a list for paediatric neurodevelopmental assessment. And they asked that as of the 5th of July, there were 1,022 young people on the list, with an average of 2.2 assessments for those on the list, the waiting list, completed per week. Given how vitally important early intervention is, what is the board doing to ensure that these young people are seen as soon as possible, and why is no support offered to the families whilst waiting for an appointment?
Yes. I'm going to ask Gillian to respond to that. Gillian will introduce herself as she speaks.
I'm Gillian Barton, Director of Women's and Children's Services, and this is one of the services that's within my portfolio. I guess, first of all, I'd like to say it's not a place where we're awful happy with our performance, but we are linking with other boards, and it seems to be a common problem at the minute. From our point of view, the numbers have gone up from July till now by 16, because we're actually able to see more children than the 2.2 who were averaging. So the number on the waiting list is 1,038. As I say, still not a number we like, but it's better than it could be, because the fellows into the system have increased by 41%. And I think there's a lot of that sort of due to sort of COVID. And people have just been about sort of watching, observing their children before. I think one of the first things I'd like to see is that the specification is not just for health. Our bit is to do diagnostic, that bit is for us. But actually, it's about how we work with our wider systems, whether it be local authorities or health assistants, school nursing, and in general, our other colleagues. And we've been sort of taking that tack. We've been going out and speaking to people. I do think that there is something we need to do better around about informing the parents that this child should get help, regardless of a diagnosis. If the child should get help, and that's something that we will be taking forward. And some of the other things we're doing is, as well as working with our local authorities, we have been working with an external provider, and we've just got them to support us to see more children while we fill the vacancies we've got in our budgeted establishment. We have had vacancies in there. We've been out to adverts 3 times. Unfortunately, there's just not the workforce out there to support. However, we do have someone who's starting with us today, in fact, so that will help us greatly with what we're doing. So we do offer sort of various things. We're doing groups, which are great need for us to help pop in some support. But it's about how we work with that wider team, so that there's a sort of team around the child concept rather than the diagnosis being the be all and end all for the child, because it is.
Okay, thanks for that. I'll open up to any questions in the room. I've got a few other ones here, and then I think is it me? Yes, you never get a chance to ask a question earlier on, so now's your chance.
You've actually, my name is Lee Campbell. I'm chair of various places in hospitals, patient public, and the other is English who speaks other languages.
Can you speak up a bit for the whole room, please?
Certainly, I'll
project as more. Okay. You've answered part of my question, which was a lot of feedback from the public. It was about capacity. It's a great concern, and it's more so because of the increase in new housing being built in Forth Valley, which is quite staggering. I'm wondering just what thought was put behind building all these new houses, when it's not only going to affect the NHS, the hospital, it's going to affect GPs, dentists, everyone. It's already taking up to months to register something. So it's a great concern for me.
Thank you. Patricia, do you want to come in and respond to some of that?
Thank you. I'm Patricia Cassidy. I'm the Integration Joint Board Chief Officer in Falkirk. This really ties into council planning processes, and the NHS Board is a statutory consultee in the planning process, and that gives an opportunity to feed into the planning processes in the local authority, and an opportunity to pitch in for some provider contributions to the development of key services, for example, primary care services in their broadest sense, but also in relation to provision of education and nursery education. So this is an area which we've been working with our local authorities and the board to try and improve, given, as you say, there is a number of pending planning applications, but also currently a number of different projects across Forth Valley area that are bringing new housing across the Forth Valley area. So it is a key area for continued vigilance and also joint working to make sure that we get any investment we can that can contribute to the provision of these key services.
The capacity is so low at the moment. You're already putting extra beds into 4-bedded rooms, which causes an awful lot of anxiety to patients who are in that situation. If all these go into the area, surely that's going to exacerbate it even more.
Let's see if Andrew, as our medical director, wants to.
Yeah, it's a really important point, and you know, when we think about the pressure that our acute site is under, sorry, I should introduce myself. Yes, I'm my medical. That would be a concern when we look at the tendencies in the department, people accessing our services. I think our chair, Jenny alluded to it earlier on, we have a lot of work to do and still to improve and optimise our unscheduled care pathway, just to talk about that. And I think we should expect that by the time our work is concluded, and that's not a quick fix, that's a kind of constant process of trying to manage the services that need to be available for people when they are acutely unwell, making sure that our discharge processes are as effective as possible, making sure all these steps are as optimised and as efficient as they can be, so that the person who's experiencing that healthcare gets as good an experience as possible. I think we should expect to be, as NHS Forth Valley, in a much, much better place. But actually, from an unscheduled care perspective, from an ED perspective, and from Delays in Hospital, should be able to cope with changes in the population, which I've seen predicted to be maybe an additional, and you might have different figures, but about 20,000 additionally over the next 10 years, 5 to 10 years. So I think when we know, and I'm not an expert, I don't work in council, I'm not public health, but I would expect that a lot of people coming into the area would tend to be young families, people who are maybe less reliant on healthcare. So, and I know our population will change a little bit as well, which we will obviously still have an aging population. But I think we've still got lots of opportunity and the need for us to improve our system to the extent that I think, and just talking about unscheduled care, I think we should be able to, for the foreseeable future, be able to cope with that. New models that we're bringing in. We're doing a huge bit of work at the moment to try and get, again, you had the chair about trying to get on the front foot for winter. A lot of our unscheduled care performance we're hoping to see over the next few years really dramatically change what they're doing. So longer term, population increase, as I said, I would hope that we'd be in a position that we could cope with whatever that demand is. But you're right, and it's, for me, it's really, in the health board, it's reassuring to hear that we are mandatory partners and consultees, or whatever the right word would be, when there are planning applications, because I hear it mainly through my GP colleagues, and Patricia will as well. primary care colleagues, that's where they're concerned, but we need to make sure that we're a very active participant in those planning applications so that it's spelled out really clearly what the expansion of service could be. So I wouldn't be too pessimistic about the future for unscheduled care, but I know there'll be issues in pressure on the food side and the pressures that people have trying to get registered in practice, which can be a very good experience.
Just putting in one little key for speakers of other languages and people with hearing difficulties, etc. It's about communication,
Yes.
especially if you go to clinics on phone, face to face. If you speak incredibly quickly and very quietly, it's very difficult to understand what's being asked. And that comes up all the time, especially if English is not your first language. You're stuck. I know we tell them to repeat, but it's really quite, and also if you're very anxious and you're with a clinician and they're speaking so quickly.
Absolutely.
It's not.
I know what it's like when I go to see my GP. I'm anxious. I know what's going to happen, and I'm anxious. So for people coming on a regular basis to the hospital or to their own GP, it does provoke stress. In terms of other languages, we try and put in enough signposting to say that you can access a translator. Worst case scenario, sometimes we've got Google Translate on our computers. We can get a little bit of that. It's not ideal, but we try to remain to facilitate it so the least best possible speed.
For anyone who's anxious about the point.
Absolutely.
What's going on?
Do you mind if I go in your first point, your primary point? I might
Do you mind to say who you asked?
Yeah, I'm about to. My name's Jeremy Garvey, one of Stirling councillors who sits in planning and regulation and has been front and centre of the conversations that have taken place regarding the big developments that are progressing within the Stirling Council area. Just to reassure you that the lines of communication have been not only open, but actually frank exchanges and conversations have taken place regarding the minutiae of the developments that have been taking place and the benefits, and community benefits, and how we try to put together a strategy. That doesn't detract from your primary purpose of capacity, though. But the projections, I would say, would be favourable towards the developments that are taking place, because it was a primary consideration as to whether or not the developments would take place. Now, we have all experienced historically and have knowledge of new developments which have not taken seriously the infrastructure elements, culturally, medical-wise, education-wise. I just want to reassure you on that primary purpose, from the very outset, that the matters that were concerning you were can be considered. So it's basically primarily want to reassure you.
Thank you. Gentleman up here.
Oh, thank you. Philip Gaskell, Chair of ArtLink Central, which commissions art for hospitals locally. But my question's not about art. General practitioners handle uncertainty and anxiety, as we've heard, and risk manage diagnostic pathways and often consider referral. About 1 in 10, 1 in 8 patients who are seen in general practice get referred. And we know that waiting times are long. We know why. We know they were long even before COVID. My question is, do GPs at the moment have those waiting times at their elbows? Because I campaigned for years for that to happen. You cannot have a meaningful discussion with a patient about risk and uncertainty unless that information is there. At least if they happen to have the money, they might want to go privately and relieve the health service of that task. It's a long time since we had a national waiting times database. NHS Lothian has its waiting times on a website called RefHelp, if anybody wants to look at it. I'm not aware of that being available for the public in Forth Valley.
Thank you, Andrew.
Thanks, Philip. And I know that, as you say, in the past, that has been a gap for us, and yourself and others and our GP colleagues absolutely recognise the need for the information. So we do have that now regularly going out to our GP practices that they can access. We also have on our public-facing website, we have a statement around waiting times and a contact number that patients can call, make an individual query. On RefHelp, we are in the process of building our RefHelp as an internal primary secondary care interface guidance. At the moment, I was actually just looking at it before I came down. It's not available yet for the public. It's on the internet, but our ambition is that would be out there, and we're building really on that with the model. So next. So But you're absolutely right. For the pressure that all parts of the system are under, we have to make sure that people have the right information, and that's a key piece of information. But I'm pleased to say that we're able to supply that now to the GP practice on a regular basis. Although I will share that there was a complaint that came through just a week or so ago just on this very point, so it's very much front and centre in my mind, that we need to make sure people are getting exactly what they need. But our website definitely has contact numbers as well that anybody can phone up straight through to the wait times department and find out where they are in that queue. What it's
At a national level, there's a piece of work that's been taken forward by Public Health Scotland to look at providing a national overview of waiting lists as well. They've already they published a bit of data. There's some criticisms of it in terms of accuracy and just some of the median wait times, etc., and potential confusion around it, which they're taking away and we're looking to try and refine. So there is an intention to also try to provide as much of that data at a national level as well, so that patients and the public can have access to that. They can see where waiting lists are, how boards are performing in different areas as well. Waiting lists are quite a dynamic thing as well, and it's trying to make sure that the system is able to respond to that, because obviously it's only as useful as the quality of the data that's put into it to give patients and the public that accurate information. So we need to make sure that doing that it's when people feel as though it's trustworthy, and it also that it works for them in terms of getting much up-to-date information as possible. Where possible, Public Health Scotland are looking at that at a national level. Okay. Yes.
Good afternoon, Carl. My name is Pam Wallace. I'm local from Stirling. I sit as the IGB services. Also as a public partner on various other health things within this area. Again, going back to its capacity, but within waiting times for outpatients. Again, I collect many stories from various people, so this is not personal. I appreciate this. But it's the fact that one gets an appointment or one goes to a GP and going into primary care, getting appointed from a GP, and it isn't acute and it isn't cancer diagnosis, but we're not quite sure. We're waiting 5 or 6 months, then this great letter arrives through the post. Now that's a long time, 5 to 6 months, not sure quite what's happening, what the situation is. The other thing is when one gets an appointment and you're desperate for it, and as I say, it's cancelled, and you then suddenly realise that this is a continuing situation where you're passed from A to B within clinics. The thing is, that would probably, it looks as if, again, people are actually being on the recall. Yes, they are going to attend, that's great. But then it looks, in fact, when you look, if you go into primary care or go into Forth Valley Annual itself, you know how you have this situation with in the month of September or May or June, there were so many missed appointments. I'm wondering whether admin and getting an appointment one time and you're getting a cancelled appointment within 40 hours. The stats just don't seem to add up to the check. I know waiting times are really tight and capacity. But it's just a thought, people are feeding back, seeing the situation. James, do you want
Thank you, Jim Cannon, Director of Acute Services. I'm sorry to hear about problems that you've been having, and you'll understand, I think the Cabinet Secretary already alluded to the fact that waiting times are quite dynamic, trying to fill as many spaces as we possibly can, which I think probably has resulted in the issues that you're describing. And often it's a flex between, planned activity and unplanned activity, and sometimes beds were available or appointment slots were available but then became unavailable because of emergency activity. So without knowing the specifics, it's difficult to give you the exact answer, but it's, I suppose, some reassurance I'm trying to give you that we do try to fill every available slot, and everyone on the ground in the hospital is trying to fill those slots and do the best they can by people, which sometimes leads to the kinds of circumstances that you're describing. Is that helpful?
Now that the acute team are looking at what we call patient focused booking, and the evidence definitely shows that that reduces cancellations from the hospital, but also from patients themselves. And I think we've got that in a few services already, Jim,
Yes.
and then looking to expand that because there's definitely evidence that that improves that situation that you're speaking about. So hopefully we'll get that rolled out as quickly as we can across all the services. I mean, not quick enough, I'm sure, but as quickly as we can.
I think they're also sending out texts now to the patients the night before.
Yes.
And I know from, because my job's public involvement as well, I'm getting feedback from the public that that's very useful.
Yeah,
Because
that's
you've maybe
helpful
had the
feedback.
appointment in 2-3 weeks or a month before,
Yeah.
but the very night before, even a Sunday night, they're getting a text and it's everybody
Yes.
can use a phone.
Yes.
Obviously.
Yes.
But
Yes.
that has been a very plus.
That's helpful feedback. I think, Jim, did you want to come back in?
Yeah, sorry, I didn't mention the fact that, we have the system of texts to remind
Yeah.
people of appointments, but also to check if you've been on the waiting list for a long time. There's a text reminder to say, are you still needing the appointment? If you've been waiting for a while, if it's a non-urgent appointment that you're waiting for. And we've also increased the amount of contact that we have with people that wait particularly long periods of time. So over 26 weeks, over the past 12 months, we've been trying to increase the amount of contact that we make with people who are waiting for a lengthier period of time, above and beyond what we would normally do, which is the letters after 12 weeks to say you've been a bit delayed, apologising for it, and the texts that we described, and also the patient that was mentioned.
You want to say?
Yeah, so I was just going to say that we've been sort of doing something a wee bit extra in CAMS. So we've managed to reduce our new patient DNA rate down from 15% to 1 to 2% over the last 4 months because we're picking up that phone and we're phoning people.
The driving down do not attend is really important because it can end up using up a lot of capacity in the system, which can end up having a knock-on effect to other patients. So the more the boards can do to try to reduce the risk of DNAs, the better, in order to try and help to ensure we're maximising the use of the capacity we've got there as well. So the boards are trying to find different ways in which to do that, to remind people of their appointments. And to check, rightly so, if you've been on for a long time, do you still need to have an appointment? Because obviously individual circumstances can change, their condition can change during that time. I've got a couple of other written questions here that were submitted that I'm going to raise with you. One is was in relation to NHS dentists in the calendar area, which over a year ago, I understand from the question is that there was a loss of NHS dental capacity in the calendar area. And the question was asking whether the board is still planning to find a replacement, possibly accommodated in the local medical centre, and if so, is there an estimated time frame for this being taken forward?
Thank you. I'm going to ask Jennifer to respond, and I don't know if you might come in more specifically, Jennifer.
Thanks very much. Jennifer Rogers, consultant dental public health. And the loss of the dental practice, which was about 11, 12 months ago, was actually changing our business models. So we changed from an NHS practice to a mixed model of private and NHS care. So other adult patients are private patients now. They offer NHS services to the children patients. So that practice still does see some NHS patients in the calendar area. The adult patients were all offered private provision at the practice and not took it up. So some of the patients went to other practices in NHS Forth Valley. Some of them went to that particular dental practice that's in one of the chains, so went to one of their other sister practices, some in Forth Valley and out with Forth Valley, and some of them came deregistered. We do have a plan to open up an NHS practice in the Calendar Medical Centre, so we've got 3 dental practitioners in Forth Valley, and we're opening a new NHS dental practice. It won't be until into 2024, so we don't have an exact date, but it'll be into the new year.
Okay.
Thank you.
Okay. I've got one more question and I'll open up to the floor for any outstanding questions. And the other question I've got here is what can the board do about all practice in Sauchie which is a GP practice, where they are suggesting it's not well run and there is a lack of consistency for patients in terms of seeing GPs and even the reception staff.
Thank you. Patricia, I'll let you.
Thank you. Patricia Cassidy again, Director of Health and Social Care. Apologies, my colleague Anne Margaret Black, who's the Director of Health and Social Care in practice in Stirling, is not here today. But my understanding that Anne Margaret and Scott, who is our clinical lead, our Associate Medical Director for General Practice, met with the Community Council recently and they were raising concerns. So there's a meeting planned with Anne Margaret, Scott, some Community Council reps and the GP practice in the forthcoming weeks.
Okay.
So that should help to address some of the issues with things.
Okay. Right, going to open up. Any other questions for?
Can I add a supplementary to this one? Because
Of course you can.
people should be aware that Hall Park, Bannockburn and Kersey Bank are run by the Forth Medical Group, which is an axis of 2 Lanarkshire GPs. They also run a clutch of practices in Lanarkshire, but they gave up contracts in Moffat and Lockerbie in January. And of course, they can't, even with good management, get a hold of doctors and nurses any better than any other practice. But the question is, what scrutiny is the health board in a position to offer to communities when what seem rather distant management structures compared to the history of general practice are failing?
Thanks. So yes, I think they've changed their name to Alba now, as a kind of consulting brand. So this model has really come to prominence in the last 5 to 10 years in general practice, where practices who are not able to sustain the partner model go into what's called 2C. Sorry, I'm just saying that with a bit of context. And so 2C practices is when the contract is returned to the health board to manage. Now that contract then will become available again for partners and GPs to take it back from the health board. For the health board to run 2C practices, it's very intensive in terms of the resources. It's not the best model, again, for some of the reasons you've alluded to, probably for the local community. So we are always looking for GPs or a primary care model to be reinstated. And that's what happened, trying to think when, probably 2019 was the time when Alba, previously Forth Medical Group, previously Lanarkshire Medical Group, took over a series of contracts for our 3 2C practices. And I think the model that they've brought, it is multidisciplinary. I think that's the way that they would present it, and felt to say that it's very much reliant on a team approach with different professionals within there. Once the contract is handed over to the primary care group again, at that point, the responsibilities for the health board are very different, and the scrutiny that we can bring is really to see if they deliver on the requirements in the contract. So Scott Williams, who you had referred to earlier, Deputy Medical Director in Primary Care, has had, it's not just been the Hall Park practice, he's been out, I've been out with him as well, Chief Executive was out as well, having discussions with the senior management team of Alba to ensure that they understood their obligations and that they were meeting those contractual obligations, because of some of the concerns that have been raised through the local community. And there are different routes by which those complaints it would be progressed to hopefully a satisfactory conclusion. But in terms of what the health board can do, we now no longer hold the contract. So it is more about ensuring that the terms of the contract are being delivered. And we've been very active in trying to do that because of some of those concerns. As I said, I think Alba, the senior team, they've engaged with the health board at every request, and they've been able to demonstrate how they measure their outcomes and reassure us around quality of care and clinical governance. So there's been that ongoing dialogue, but it is an important area because primary care in NHS Scotland and the Forth Valley, has been under pressures, and practices recently have found that there's probably more 2C practices than there were in the past. And when you have a consortium that's taken over practices, it does raise some questions for a health board around, the size and the sustainability of those models coming in. So I want to reassure you that our colleagues in Alba have participated and really been engaged with the health board and we've provided that scrutiny to them and received information back to give us that assurance.
Okay, any other questions in the room? No, I'm very conscious of time and we're running late, so apologies for that. It's often the case when it comes to annual reviews. Other than for me to say thank you very much for your attendance here this afternoon. Thank you for your questions. For those who are engaged in the partnership with the board, thank you for your input and engaging with them, supporting them and challenging them, rightly so, as and when is necessary as well. I'll now have an opportunity to meet some of the executive team to over some aspects of performance and also plans for going forward, particularly into the winter, because there's clearly more for the board to do in that area, but we've got an executive team who I know are very much focused on doing exactly that. So thank you for your time. I hope you found it useful. And I hope if there are any outstanding questions that you have there, that you feel free to get in touch with the board and they will respond to those directly as well, or to speak to a member of staff after this part of the meeting has been completed. Thank you very much.